Hello, it's Dr. Jacob Lilly with Enhanced Chiropractic Relief, and I'm going to talk to you guys about injury prevention. So when we think about injuries, when it comes to musculoskeletal injuries, such as like tendonitis, such as, muscular strains, ligament sprains, low back injuries from improper lifting or, jujitsu or intense sports, we need to understand why such things tend to happen. So typically, if you're not in any type of like trauma, meaning like you weren't dropped off a building or you weren't in a car accident, you weren't in just egregious incident during a sporting event or something like that. Typically these issues are things that build up over time. So for the sake of this video, we're not going to dive into the trauma related things, things that are often outside of our control. For today's video, we're actually going to speak primarily about things that are building up over time and how we can stop it and reverse it so we can prevent injuries in that case. So the most important things you need to know when understanding how injuries occur is, number one, probably the most common way people injure themselves is doing too much too often. And what that means is, if someone's new to the gym, for example, or they haven't been working out for like 20 years and they start to pick up running, or if someone who's been sedentary for most of their life starts hiking or wants to get back into recreational sports, a lot of the times they're doing this from literally sitting on the couch or doing nothing for such a long period of time, and then they're jumping into intense activity. You can probably see how that is not the most ideal thing to do. Now, if you're someone who isn't conditioned to handle these loads, you're going to feel the aches and pains right away. Now, what happens is, you feel those aches and pains, you sleep it off, you feel better the next day, and you continue doing it. This is where we start to run into problems where you're doing a little bit too much too quickly. And most of the time we see this with activities or sports that we end up doing every day, such as like weightlifting and running. Especially with runners, most people that pick up running tend to do it because they want to lose weight, and which means that they either feel or in some regards are a little bit overweight, and they're trying to push their bodies a little bit too much than what they might be able to handle at that particular moment. Same thing with weightlifting. They might be doing a little bit too much, too fast, and that's when these injuries start to kind of occur. Number two is kind of piggybacks off what I previously just said, which is slow progress is the best progress. In order to prevent injuries in that case where you're doing too much too quickly, you need to slow it down and space these things out, at least in the beginning. And once we kind of get an adequate fitness level, then we can start to scale up. It's a concept called progressive overload. Many fitness professionals or trainers may talk to you about this idea of progressive overload, which essentially means that each week or each couple months, every micro, meso, macro cycle, we're just slowly adding and inching forward a little bit more, whether that's a little bit more weight, a little bit more volume, so like more reps, and just making the workout a little bit more intense each week, or however your trainer structures it. It's the same thing when it comes to injury prevention. If you follow that systematic approach of just tiny baby steps, inch by inch, you have less of a chance of injuring yourself. Another reason why injuries often occur is just due to improper lifting, for example, or improper running mechanics if you're a runner, or improper throwing motions if you're some sort of overhead athlete like a quarterback or a pitcher. A lot of the times there's specific forms that are ideal, biomechanically speaking, that will keep our joints, keep our muscles in optimal position so they decrease the risk of injury. For example, a lot of the time I see patients that come in for lower back pain because they lifted something wrong, whether they were moving and they were lifting a box, or they were just in the gym and they overdid it in the gym and were tired and they did deadlifts at the end of their set and they hurt their back. So paying attention to how you're doing things is also important when it comes to preventing injuries. When it comes to weightlifting, for example, like if you're doing deadlifts or if you're doing squats, or even like bench press, there's specific ways that just make it a little bit easier on your body, a little bit easier on the joints, helps protect it a little bit so we can decrease the chances of these injuries. But these are just some examples of why it's important to kind of understand that the way you do certain things, your form specifically, is extremely important when it comes to injury prevention. Another thing to consider is previous injuries. A lot of people brush off previous injuries like, oh, like, yeah, like I've had back pain before, didn't really do anything about it, just kind of like left it alone and it got better on its own. Now, that's good. If it's gone a little bit better on its own, chances are it wasn't that serious to begin with, which is good. However, on the flip side of that, the most common predictor of low back pain in the future is actually previous low back pain. So if you've had back pain in the past, there's a greater chance that you'll have it in the future. With that in mind, one of the most important things to understand is previous injuries and how it can affect your life downstream, especially when you pick up a new hobby or get back into fitness and things like that. All these like old aches and pains, the old sports injury, I could have gone pro if my knee didn't get injured, things like that. That can have a consequence down the road. So definitely don't ignore even minor injuries like ankle sprains, because those typically can mean a lot. So, and lastly, I want to talk about load tolerance and volume tolerance. So the capacity at which you can withstand the stress placed on your body versus how much stress you're actually putting on your body. It's very minute in the difference, but if you really listen and understand it, it makes a whole lot of sense. So load tolerance is how much your body can tolerate load. So if you think about like a barbell and you're doing a squat, the barbell with the weights would be the load, and if you can perform it, you can tolerate that, for example. But let's say you put 500 pounds, you're just going to fold like a chair if you're not used to that, if you can't tolerate that. So make the distinction of how much load that you're putting on your body versus how much you can withstand. Now, same thing with volume. Volume is just how many reps you can do. Now, if I can do 10 reps and I get tired after 10, that can be around my limit. Now, if I can do 20 reps and I start to kind of fail or fatigue, then I have a higher volume tolerance than a person that can do only 10 reps, for example, before failing. So understanding load versus volume and how these kind of inversely correlate with each other is extremely important to know when talking fitness or loading, especially when it comes to like lifting weights. It's a little bit harder and a little bit more difficult to do if you're like doing running, but that's why it's very important to have a coach or like a competent chiropractor, physical therapist, again, some sort of health professional to kind of monitor these things and give you advice accordingly. And finally, there's a couple things that you need to consider when thinking about preventative strategies in terms of like dealing with your pain. For example, like what can I do to fix it? Well, you need to understand that age has a very big factor on it. As you probably know, as you get a little bit older, in the middle age, so in your 40s and your 50s and even into later ages, you're just going to have these aches and pains that sometimes like just come out of nowhere. Now, with that understanding that these things will happen in the future, it is in your best interest to take care of these things earlier on. When you're younger, you might not feel these aches and pains, but you might feel invincible, but trust me, they do come later in life. And I hear it from every single one of my patients that are probably over 30 years old. They have some sort of aches and pains that they've dealt with that was either caused or was some issue downstream of their life, 5, 10, 15 years ago. So making sure to understand that as you get older, these things will eventually become a problem, and fixing them accordingly is in your best interest. Proper diet is probably the most underutilized part in terms of injury prevention and recovery, because you don't really think about what am I eating today that's going to help me feel better 5 years from now or even a year from now. And that's very important because, and then getting back into the gym to rehab it correctly or strengthen it correctly. Another thing, again, is proper sleep. So getting 7 to 9 hours on average of good, uninterrupted, deep sleep. So whatever it is that you need to do, whether it's meditation, praying, stretching, whatever it is that you need to do to get proper sleep the night before, or every night for that matter, even if you need to see some sort of sleep therapist or sleep medical professional, do that, because sleep is by far one of the most important and vital aspects of our recovery, and just for not even for fitness, but just in general for overall health. You want to make sure that you're also drinking enough water throughout the day. So the recommendation that I usually give is a gallon. I mean, it's simple. Not everyone needs a gallon, but for the majority of people that I see and even just talk to on a regular basis, a gallon is just a pretty good number to hit. Now that number will obviously change a little bit depending on how active you are, how much you weigh, things like that. For the general consensus, most people kind of fall in that category of having a gallon of water a day. A gallon of water is just a good rule of thumb to follow by. And lastly, one of the most important things that you can do, especially as you age, is stretching and mobility. As a personal trainer and as a chiropractor, I've seen people who just lack proper ranges of motion, and able to control themselves through that range of motion effectively and safely. If you're one of those people that, again, hasn't worked out in a couple years, or they had an injury or had some sort of life event and they just kind of took time off from exercising, getting back into stretching and mobility routines will help you down the line. I often say stretching and mobility is often the most overlooked thing when it comes to fitness, and that's a shame. Everyone wants the big muscles, everyone wants the nice body and whatnot, but they don't really think about the stretching and mobility part that's going to keep them feeling better, feeling healthier in the long run. Again, these are all things that are supposed to be aiming towards the future. How are you going to feel 5 years from now, 10 years from now? Stretching and mobility will help keep you in that zone, keep you working out healthy and safely, and just overall keeping you feeling better. And the last two, I would say, corrective exercises. So if you have any sort of imbalances, I usually find these with athletes, especially like single arm athletes, like let's say like pitchers, they're throwing with their right hand. Typically they have a lot of compensations because their left side is often underutilized and their right side is overutilized. So restoring that balance is often a very key component with just general health. It kind of varies when it comes to sports performance. So that's another topic for another day, but when it comes to overall health, fixing up those compensations is often a really good thing to do. And that kind of leads me to my next point, which the best way to do that, again, is either seeking some sort of manual therapist, getting a massage, again, seeing a chiropractor, a physical therapist. They all can kind of help you with these compensations and just overall keep you feeling healthy, feeling young again. That's one of the reasons why I got into the profession, was to spread that influence of just having people feel good. Seeking a trusted health coach, we'll just keep it very general in that sense. A health coach, really in your best interest to have someone that's dedicated to you as you are to them and understand every little thing about you as best as possible. So with that said, I know I talked about a lot of topics, a lot of concepts. If you guys have any questions or things that I might have missed, please leave a comment below. I'll get back to it. Maybe I'll make another video, a follow-up video next week or in a couple weeks, and dive a little bit deeper into this topic. I know it's a pretty big one. People always want to be out of pain. Unfortunately, a lot of people kind of have to wait until the pain comes before they go see someone. That typically is not the best habit to have. Like I said, as you get older, these issues just kind of compound and don't really leave unless you really get it addressed and fixed. So, again, leave a comment below if you have any questions. Thanks for watching the video, and we'll see you next time. Take it easy.